An NG tube is passed through the nose into the stomach. It may be used for enteral feeding, medication, gastric decompression, or aspiration of gastric contents, depending on the clinical indication. Before we begin, I am reviewing your clinical indications. This is to ensure that everything aligns with your doctor's order. An NG tube may be used for gastric decompression, enteral feeding, medication administration, or obtaining gastric contents, depending on the clinical indications. First, identify the patient, explain the procedure, provide privacy, and obtain consent according to local policy. Before insertion, verify the order and patient identity, explain the procedure, perform hand hygiene, gather equipment, and assess the patient for contraindications and aspiration risk. First, we need to measure the tube. We go from the nose to the earlobe, and then down to the upper abdomen. Now we mark it, and we are all ready to go. Now tilt your head back just a little bit. I'm going to gently pass the Okay, Mr. Jones, let's begin. I'm going to guide this straight back. Now tilt your head forward and swallow for me. Perfect, you are doing wonderful. If distress occurs, do not force the tube. Stop and reassess their respiratory status. Reassess their respiratory status. I'm going to guide this tube in now. Please take a sip of water and swallow. You are doing perfectly fine. You are doing perfectly fine. Great job. First, I will check the tube's placement. I'll check the pH of this aspirate. An X-ray is the gold standard for confirmation. Let's make sure it's not pulling or too tight. Great, that should feel quite comfortable now. Let's check your comfort level. Take a deep breath for me. Everything looks perfect.
Thank you, nurse.
Let's review the NG tube insertion. Assess, prepare, and position. Measure, lubricate, and insert. Emma guides the tube through the nose. Sip water to help it slide down. Stop insertion if distress occurs. Vary the tube to the nose. Secure the tubement. Document all of the care. Confirm placement before use.